As you know, last week, the Republican-controlled House of Representatives in Washington passed TrumpCare, the Republican health care bill. I voted against the bill because I believe it will have a devastating effect on New York. This bill will result in 24 million Americans being without health insurance in the first 10 years. The number of people without insurance will go up to more than were uninsured before the Affordable Care Act was passed. It will take $800 billion out of Medicaid and another couple $100 billion out of Medicare for a total of $1 trillion in cuts to Medicare and Medicaid. And it will give that money over $600+ billion to the very richest in a tax cut. It's hard to get your head around how foolish that is, to take from the sick and give it to the rich. But that's exactly what this bill does. And it does more. It would defund Planned Parenthood. What does that have to do with improving health care in the Hudson Valley? There's 33,000 families that depend on Planned Parenthood. It would result in 60,000 people in my district losing their health insurance. It would result in almost 290,000 people with pre-existing conditions having to worry about whether they would have health insurance or not. And don't believe anybody who tells you that coverage for pre-existing conditions is not threatened by this bill. This bill contains a waiver provision so that states can allow insurers to stop covering pre-existing conditions. And any state that does that will have insurers that can sell policies to people right here in New York, because that's in this bill too. Which means if any state gets a waiver, according to the Wall Street Journal, then employers, even in places in New York where we wouldn't get that waiver, can issue policies to their employees that do not cover pre-existing conditions. And remember, under TrumpCare, employers are not required to provide health insurance at all. And that's why so many people will lose insurance in the next 10 years. It will put enormous pressure on the budget of the state of New York, because it will be $7 billion at least in the first few years, right off the top for the state. And that, ladies and gentlemen, is going to create pressure on everything else, from your property taxes to everything else we do in this state. So this bill is terrible for New York. It is terrible for healthcare.
I don't know what's going to happen to me. And I feel like I'm being punished for the way I was born. And that throughout my life, no matter how hard I worked to do what I needed to do to take care of myself and my kids, that I am now being punished. So where we have in this country racism, sexism, discrimination against so many things, this is a new kind of discrimination against people with health issues, pre-existing conditions, and disabilities.
And we ought not to go back to the bad old days when people with pre-existing conditions could be left out. We ought not to corral them into some high-risk pool that's going to stink and give them substandard health care. And we shouldn't be running over veterans, and we shouldn't be threatening our efforts against the opioid epidemic, and we shouldn't be blowing a hole in the budget of the state of New York. For what? To give $600 billion in tax cuts to the very richest. I mean, honestly, I have never seen anything this bad since I've been in public life. And I hope I never see anything this bad again. And we have to defeat this bill. But if you give me a little more time, I'll tell you how I really feel about it.